Hello everybody. Today we are going to discuss about gastroenteritis, which is a very common condition caused diarrhea, vomiting, um, caused by a virus or bacteria. All ages are affected, but more common in young children. Uh, children's cases, it caused mainly by a virus called rotavirus, but it can be by other things like norovirus, food poisoning, bacteria. It's very unpleasant, but it clears up within a week. So basically, you can take care of your child um, at home um, about going to GP unless you are very worried. But you can call NHS 111 or you can call GP for taking the advice for your child. So symptoms are now it is suddenly watery diarrhea, feeling sick, vomiting, or mild fever with body ache, discomfort of the tummy. All these things can happen to you about this. Now, looking after your child with gastroenteritis at home, basically, any no specific treatment we can tell, but usually they feel better in a few days. So normally, not need to take any medical advice, but if not improve or you are worried, you can call them. Or what are the things you can do to ease the symptoms because they not feel well if there is, gastroenteritis. Encourage them to drink plenty of fluid. Because they needs to replace the fluid of that working or losing in vomiting or diarrhea. Water generally best. Fizzy drink is can make the diarrhea worse. So that is, but sometimes we use it, but it is not ideal. And babies should continue to feed like breastfeed or other milk feed. Plenty of rest. If they were very hungry, little bit of plain solid like soup, rice, pasta, bread, you can give paracetamol if they are uncomfortable with fever. Um, and a special rehydration drink made of sachet available in pharmacy. If you think that is needed, you can use them also. Um, Antisickness will not advise until you see by a medical professional, and you have to use always wash your hand and your child's hand when child is ill. Keep them away from school or nursery until 48 hours after the symptoms clear. Get advice from your child. So basically, you have to, you know, take advice if you think there are symptoms of dehydration. So it's a very less amount of urine passing, irritable, unresponsive, pale, mottled skin, cold hand and feet, blood in their poo, green vomit, vomiting constantly, not able to keep anything down, and diarrhea for more than a week, and vomiting for more than 3 days, and other signs of serious illness like high fever, shortness of breath, rapid breathing, stiff neck, rash does not fade when you roll a glass over it, bulging fontanelli, that is soft spot here on baby's head, serious underlying condition like other weak immune system, other serious condition, then I think it is better to take advice and to whether to see urgently by doctors. So basically, GP may suggest send the sample for you. We poo for confirming it is a serious infection, and after that, it may need to be prescribed some antibiotic. How gastroenteritis spread? So it's very easily it can get from a small particle of poo or vomit from one person to another person into the mouth. Close contact, touching contaminated surfaces, eating contaminated food, all these things can easily. So it is really, really important. Preventing is very important. Yeah. How can you prevent from, so stay off the school and nursery until the 48 hours of symptom passed, and washing hand frequently, that is very important. Use before, after using toilet, before preparing food, and don't rely on alcohol gel. They're not very effective. Disinfect at any surface and object that could be contaminated, and best to use bleach based cleaner. Wash contaminated item of clothing and bedding separately in hot wash. Flush away any poo and vomit in the toilet and potty, and clean the surrounding area. Practice good food hygiene. It is make sure food is properly refrigerated, cook fruit thoroughly, and never eat that is past its use by date. And don't rely on alcohol hand gels, they are not effective. Don't share towel, flannel, cutleries, utensil when child is ill. Take extra care when traveling to the part of the world with poor sanitation. You could pick up a stomach bug, and you need to boil the tap water before you drink it. And young childs can have rotavirus vaccinations when they're 2 to 3 years old, which can reduce the risk of developing gastroenteritis. Hope this little talk helps you, and we'll discuss with another session other things. Bye for today.